Care for Kids and Families is a statewide effort to improve the cultural responsivity of child and family mental health services while centering youth, caregivers, and community members with lived experience throughout the design process. This video traces the first year of CARE, why and how we came to be, and where we're going next. CARE began when multiple policymakers and treatment providers came together to identify the top needs in our state's publicly funded children's mental health system. Many priority areas came up in discussion. However, when participants were asked to identify the most urgent need that would improve the children's behavioral health system right now, the answer was clear: expanding culturally responsive care. We are in a child mental health crisis, and this is hitting families of color particularly hard. Because of systemic racism, people of color are more likely to be economically disadvantaged and therefore are enrolled in Medicaid at disproportionately higher rates than white people. This means that BIPOC families are also disproportionately impacted by workforce shortages, and it's critical that publicly funded behavioral health organizations are providing culturally informed and relevant care. The goal of CARE is to expand and increase diversity in the mental health workforce for Medicaid services, to support the existing workforce to deliver culturally responsive care, and to empower clinical directors and managers in supporting these two innovations. We're using a strategy called policy co-design that draws from collective wisdom and systematic knowledge to design a product that works for Washington state families. Our policy co-design strategy is centered around 3 levels of involvement. Our core co-design team leads the project design by integrating different knowledge sources and bringing lived and professional expertise from multiple lenses. Our broader advisory team has brought additional layers of expertise and provided valuable feedback throughout the design process. We've also gathered public input through our community sounding board, volunteers from across the state who have helped guide the initiative through feedback surveys and activities. We've pulled information from a variety of sources, including listening sessions, systematic research reviews, and strategic questions posed to our community sounding board and advisory partners, prioritizing knowledge from those with lived experience interacting with our public systems as well as subject matter experts. Our co-design members are the information integrators of the project. Through regular facilitated meetings over the course of the past year, our co-design team members have developed a new model for culturally responsive care. As of May 2023, we've confirmed principles of culturally responsive care to guide all 3 goals, developed a training outline for the existing workforce, and gathered information about policy pathways for an expanded workforce. In the next year, subcommittees will finish product development for training the existing workforce, training community health workers to support child and youth mental health care, and coaching organizational leaders to implement the first 2 innovations. We're also partnering with policymakers and advocates interested in finding the policy pathways to pay for this workforce expansion. We plan to begin to pilot these materials in the spring of 2024 throughout the state. As we move forward, there will continue to be plenty of ways to be involved with this project. Visit uwcolab.org/care to learn how you can join our community sounding board, advisory board, become a project amplifier, or join a subcommittee. Thank you for your interest in Care for Kids and Families. We believe that through this program and with your help, we can increase and improve mental health equity in Washington state.